I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. We have a great show for you today. We're going to talk about liver disease, and I have the perfect physician to talk about this particular topic. But first, I'd like to share with you my sharing and caring. You guys are outdoing yourselves as far as the emails, and occasionally I get a tweet as well. Listen, keep it coming, guys. It lets me know what's going on out there. It lets me know what your problems are so we can cover it on this show. And together we can improve each of our healths. Remember, your health is the most important thing that we have. Well, getting to our topic, liver disease. And I have Dr. Ruby Sampson. She is a gastroenterology, hepatology specialist, and she's going to cover liver disease from A to Z. Dr. Sampson, welcome to our show.
Thank you for having me, Dr. Bey.
All righty, right. I'm glad that you could come. I know you have a busy schedule, but I'm glad you could come and share your time and your knowledge with us. All right, I'm going to start with my favorite question, my number one question, and that is, what does the liver do, and what does it do, the liver?
Well, the liver is a very important organ. After the skin, it's the largest organ in our body. Mm-hmm. And the liver has many functions. One of the functions is to produce proteins that carry things with it, such as drugs. One of the functions that the liver does is it breaks down drugs that we ingest. It has to metabolize them so that we can get rid of the waste. The third thing that it does is it produces clotting factors so that when you get cut, you won't bleed to death. So, and the fourth thing that's very important is that it produces bile, which is a product from broken down recycled blood cells. Mm-hmm. So it produces bile, which is used to digest fat. So it has a lot of very important functions.
So what you're saying is that we probably could not live without the liver, the type of functions that you're talking about.
Absolutely not. Mm-hmm. And there's an old joke about which organ was in charge. Well, the liver is definitely in charge. Without a liver, you cannot live.
Right. So yes. Step back heart, step back lungs.
That's
lungs.
Right.
It's the liver.
It's the liver.
All righty. All right. Tell me, where is the liver? And as far as our body is concerned, where is it located? So if we had, if we thought we having a problem with it, maybe it would be a pain here or there. At least I'd know where it is.
The liver's on the right side. Mm-hmm. It sits under the lungs. The diaphragm is the big organ that divides the chest from the abdomen. Mm-hmm. And the liver sits under the diaphragm on the right side.
Mm-hmm. All righty. So it's right about here is what you're saying.
It's right about here, right under the lungs on the right side.
All right. Now let's talk about symptoms. All right. How would a patient usually present to your office with symptoms? What symptoms would they have to let you know as a doctor that they may be having a liver problem?
Okay. Well, if you go back to those major functions that I told you the liver covers, if any of those functions malfunctions, then you're going to present with a problem. For example, if your liver is not making clotting factors, then your bleeding time will be elevated and you will bleed very easily, and you can detect that by the blood. Another thing is that you'll notice that your feet start to swell, because if you don't have protein, protein holds fluid in the blood vessels. If you don't have protein, the fluid just kind of shifts and goes everywhere, into the feet, into the belly cavity. So they may present with a swollen belly, which is called ascites. It can present with very large swollen feet. And you may present with a jaundice, which is elevation of bilirubin in the bloodstream because the liver is not functioning.
Now, when you say jaundice, is that when you kind of get a greenish or yellow-looking eyes and stuff like that? Is that jaundice?
Absolutely. Jaundice is characterized by yellowness of the eyes, yellowness of the skin, and for African Americans, it may be a little bit more difficult to detect jaundice until it's very late, but you can notice that the eyes are yellow. The other thing that one would notice is that the urine becomes very dark, tea-colored, or Coca-Cola colored, or it would become very light, like gray because bile is what gives your stool this nice green brown color. If the liver is not producing the bile or is not producing it the proper way, it's not getting where it's supposed to be, so your stool will be very gray, and that's usually things that people notice first.
Okay. Does it usually pain you? Is there pain associated with when your liver is having a problem?
Yes, the liver will be, if it's inflamed, and it can be inflamed for a number of reasons, that you will feel pain over the area of the liver. You may also become nauseated and vomit when you get inflammation of the liver. And since the liver doesn't have direct pain fibers, it shares its fibers with the shoulder. So you can have pain in your shoulder when you're actually having liver pain.
Oh, goodness gracious. Now, how do we detect, for instance, you may think you will see all these signs, but is there any way that you can draw bloods or do some type of test or something to figure out whether the liver is truly having a problem?
Absolutely. As I said, the liver is responsible for bile. It actually manufactures the bile in the liver from broken down old and recycled blood cells.
Right.
And also you can get bile elevations when blood cells break on their own. The way that we can tell whether or not it's coming from the liver or it's coming from broken down blood cells, there are certain blood cells tests that you can do, such as alkaline phosphatase, or you can actually split the bilirubin into two parts, indirect or direct.
Right.
If it's indirect, it's usually coming from broken down blood cells. If it's direct bilirubin, that's usually coming from the liver or has to do with the gallbladder.
Oh, okay.
Yes.
So you can draw blood, look at these factors, and determine that the liver is truly having a problem.
Absolutely.
Oh, all right then. Okay. Now, if you have if your liver, as you said, it becomes inflamed, can the inflammation or the swelling in the liver just go away? Can it just, you know what I mean, without a big problem?
Absolutely. It depends on the cause for the inflammation. Alcohol is probably the biggest factor that causes inflammation in the liver. So if a person drinks enough, you can irritate your liver because the liver breaks down alcohol. You can't metabolize it without certain enzymes in the liver. If you overwhelm the liver, it just kind of like gives up and it gets inflamed, and that's what we call alcoholic hepatitis.
So if I have my glass of wine tonight, I'm gonna
one glass is not gonna do it.
You need more than one glass.
Have a little bit more than one glass tonight. You gotta do a few fifths, and that overdoes it.
Okay.
Usually you push it beyond your limit. So if that happens, the liver is inflamed. You'll become nauseated, fatigued. You'll have abdominal pain, and if in a couple of days it'll actually get better if you stop drinking.
Oh, okay.
So that's one of the things that can cure itself. And while we're talking about alcohol, very, very important point to make is that Tylenol, even in normal doses, one Tylenol, 2 Tylenols a day, if you drink like 1 or 2 glasses of wine a day and you take Tylenol every day, that can really inflame your liver.
Oh, goodness.
It can cause the enzymes in the liver, those tests that we check to see if the liver is inflamed, go up. These are actually enzymes are contained inside the liver cells. When the liver cells are irritated, they break open. So the contents spill into the bloodstream, and that's what we measure to determine if the liver is inflamed. The normal blood cell concentration for most of the liver enzymes is about 40, up to 0 to 40.
Right.
So if you drink a little bit, they may go up to like 80, 90.
Right.
If you drink a little bit and you take Tylenol, they go up to like 6,000.
Wow.
And it can be very dramatic, and it goes up really fast and it comes down very fast. So the point to take away is that you should not take Tylenol regularly and drink.
Okay.
It's a deadly combination.
Now, you had said something earlier that the liver actually breaks down certain medications that we take. So Tylenol would be one of those medications that the liver tries to break down.
Absolutely.
But it has a problem, or the Tylenol actually hurts the liver if it doesn't break it down appropriately. Is that what's happening?
Absolutely, because the enzymes that are being used to break down are shared enzymes. They both need the same enzyme. So it overwhelms the liver and it just becomes very, very toxic to the liver cells.
Oh, interesting. Well, let's talk about something that's very important. Let's talk about hepatitis. because that is a topic that, it's getting a lot of press right now, and new things are happening out there about it, but it's a serious disease. And I know there are different types of hepatitis.
Yes.
Just to tell you, my son is taking a trip, and he had to go and get his hepatitis shots because he was going across seas, and the area that he was going had a particular type of hepatitis.
Absolutely.
So we were very, very not upset, but worried about this, him going over there.
Absolutely.
So tell me about hepatitis.
Well, hepatitis just means inflammation of the liver, regardless of the cause. And it could be alcohol induced, or it could be viral. And viruses are these little things that don't go away when you take antibiotics. They're a pain in the neck.
Right.
And they just like to live in our bodies. They're little parasites. And there are certain viruses that like to live in the liver. And they go from hepatitis A, B, C, D, E, F, G, H. You have a lot of hepatitis.
Oh, goodness.
There are some that are only found that were very deadly in pregnant women. Hepatitis A is probably the most common type of hepatitis that we don't know that we had it. And this is another important point. Hepatitis A is spread through fecal oral contact, which means that there are lots of people who don't wash their hands when they go to the bathroom.
Oh, boy.
And they touch the door on the way out after having a bowel movement, and the virus is shed in your stool. So when you touch that door, now the virus is on the doorknob. Now you come along and you're a good person, you wash your hands, but you touch the same door on the way out. Now your hand is contaminated. You go and eat. I just washed my hands, so I grab my bread and I eat it. Now you've eaten the hepatitis A. That's the way that most hepatitis A is spread.
Goodness.
And it usually comes and it goes. You feel horrible for a couple of days. It gets better. It doesn't cause any chronic damage. So that's a good one to have if you're going to have one. Probably the one that they're getting your son to get vaccinated for.
Right,
Hepatitis A is very prominent in underdeveloped countries. Now, hepatitis B is the other one that's really, that's an important one. It's chronic. That causes chronic damage. It means that it doesn't just come and go. It can stay for years, and it can cause serious damage down the line, like cirrhosis of the liver, which can then be a backdrop for liver cancer. So that's why it's very important to diagnose that, and now we do have some treatments for that. Right now, we're really focused on hepatitis C, because it's another chronic one. The danger of hepatitis C is that it can be in your liver for 20 years and you never know it.
Oh,
and for years, we could to detect hepatitis A and B, because we had in the blood what we called antibodies to these viruses that we could detect. Well, we didn't have an antibody for hepatitis C until like the late 80s or early 90s. So when you went to give blood, they would check your blood, and if you didn't have hepatitis B, they said, okay, you can give blood. And then the person had hepatitis C, which we didn't know at that time. We called it non-A, non-B, because we knew there was something going on, because we would check the blood, and the liver enzymes that go up when things are not right will go up, and then they go down. They go up and they go down. When we checked it, it looks like it's a virus, but we can't find it. So we said, must be another virus there. It's not either A, it's not B, so it must be non-A, non-B. That's what we named it. And then years later, we came up with an antibody that detected hepatitis C. So then we were able to detect it more. So it's not that it's more common now. It's always been there. We just couldn't pick it up.
Right.
Now that we pick it up, we know that there's an epidemic of hepatitis C going around. Now, how do you get it? Very common way that we used to think was the only way was blood transfusions. Now that we can detect it, that's very, very much less. But the important thing to know also is that we detect hepatitis B, C antibodies, but not everybody makes antibodies. So if you don't have an antibody, you can still have hepatitis C, and we don't pick it up. So that doesn't mean that it's 100% that you don't get it from blood transfusions, but it's a lot less. The other way that you get it is through blood contact. So if you are IV drug abusers and you're sharing needles, if I have it, now you have it. It's also sexually transmitted, so it is a venereal disease. Now, it's not as easily transmitted as hepatitis B or HIV, but it certainly is transmitted sexually. So we do need to know that, it's something we need to be careful about. Now, once you get it, we used to think there's nothing you can do about it, you just kind of let it run its course. But because hepatitis C is a chronic condition that can lead to cirrhosis and be a backdrop for cancer of the liver, we need to treat it. And we do have drugs now that are available. It's not 100%, but we've come a long way, especially in African Americans who tend to not respond as well as Caucasian counterparts. We used to get a response rate of about 28%. Now we're over 50%.
In overall or African Americans?
In African Americans.
Okay.
And in overall, it's probably like 70, 80%. But African Americans, we have over 50, and some of the newer drugs that are coming out are promising to give us close to 80% cure rate.
Excellent.
So it's a good idea to go and get treatment. Not everybody responds, but a good percentage of people do respond. And since you don't know who's going to get cirrhosis and get liver cancer, we need to treat 100% of patients who have hepatitis C.
Right, right. Let's step back just for a second. You had covered how you would get hepatitis A very well. How do you get hepatitis B?
Hepatitis B is another one that's blood-borne,
Okay.
and it's also in your bodily secretions.
Okay.
So it's in the semen, so it's sexually transmitted.
Sexually transmitted, right?
You can get it from a needle stick, which
Okay.
is probably the most common way, and something that we don't think about. If you go to a dentist and they don't clean their instruments properly, that's a good setup for hepatitis B or C. If you go to a podiatrist or you go to get your nails done and they clip and they shave with those razors that are not clean, they put them in that little thing and you don't know if that light's doing anything or not, and then you do the next person, that may be a way that you're spreading hepatitis B and C.
All right, all right. You mentioned the word cirrhosis.
Yes.
What is cirrhosis?
Okay, I'm glad you asked that. Cirrhosis is it's a stage in liver disease. And so when the liver gets inflamed, initially, we call it hepatitis. And that just means that, oh, I was overwhelmed, you know, and like I kind of like, some of my cells got swollen, they opened up and everything got better, back to normal. So that happens a few times, and then you start to get like a little scab over the areas that have been, you know, irritated. And so the scab is what we call fibrosis, which means little scars in the liver.
All right.
Now you just continue to keep scarring over the same areas over and over again. Now the liver becomes hard, and that's what we call cirrhosis.
Okay.
And once it becomes cirrhotic, it no longer performs those functions that it needs to: blood clotting, proteins, bilirubin, and those things.
Okay. Now the liver actually makes the proteins in the liver itself?
Yes, it does, yes.
And you said these proteins, some of the things...
Like albumin.
Albumin. That's a big word for everybody too. It kind of
Albumin.
flies over my head. Albumin's
yes.
a protein. And that protein, it's in the blood vessel, and that's what holds our water into the blood vessels.
Absolutely.
If we don't have that albumin or that protein,
Yes.
the water kind of sifts into the tissues.
Absolutely.
And we get swollen feet.
Absolutely.
That's why my feet are swollen at the end of the day.
And you know, and if you're not eating, if you're like ill and you're not eating for, you know, a couple of weeks, your albumin level starts to go down. So nutrition is very important to keep your liver functions where they're supposed to be.
Okay, okay. Tell me about vaccines.
Okay.
All right, for hepatitis.
Okay.
What are the vaccines? What are they made of, and why do they work?
Okay, vaccinations actually means that they take a portion of the virus and they kind of kill it a little bit, and then they expose you to it. So your body now it's like, oh my God, what is this? So you build up a defense. And so when you come in contact with it again, you've already got like an armor, and it can't do you any harm. So, you know, by giving you a little bit of the virus, then you make up proteins, which are antibodies against the virus. So if the virus comes into your system, it can't hurt you. And so we do have vaccines for hepatitis B. We have had it for a long time. Hepatitis B vaccine is, you know, a series of 3 shots. You do it today, you do it again in 4 weeks, and then you do it again in 6 months. And then you have to check to make sure that it works, because sometimes it doesn't. My daughter was vaccinated at birth, and at 18, when she was about to go to college, we checked her just to make sure she had no antibodies. So we had to do it all over again. We unfortunately don't have a vaccine for hepatitis C. But we do have one for hepatitis A, and travelers tend to have to get it because we go into countries where, you know, hepatitis A is common. You don't want to get sick. But another important thing about hepatitis A, patients with hepatitis C, if you have a chronic liver disease and you get something acute on top of that, it's really bad. So we recommend that anyone who has hepatitis C be vaccinated with hepatitis A.
So if you get one hepatitis, you can get another hepatitis?
Absolutely,
Oh,
absolutely.
boy.
I've had patients who had a patient who actually I cured him of all of these, but he had hepatitis A at some point, but he had hepatitis B, and hepatitis D needs B to be present to live. So he had hepatitis B, he had hepatitis D, and he had hepatitis C, and I actually cured him of all of them.
Boy, oh boy.
So,
all righty, all right.
that's a rare one, though.
Yeah, yeah. Now, getting back to the vaccination, so what you're saying is once you give the body a little piece of the virus, or it's probably dead, it's not alive, hopefully.
No, it's not live. They kill it, so it's very
right.
weak. It can't do
All
much
right.
harm.
And then the body, certain cells in the body build up like an armor.
Yes.
And a memory.
Yes.
So that if that virus comes in there again, they're ready to fight it.
Absolutely.
That's what happens.
Absolutely.
Oh, all right then. All right. Let's talk about, now you talked about cirrhosis, hepatitis, the inflammation. You talked about cirrhosis. Now let's talk about the cancer. Why does the cirrhosis go to cancer?
Well, we're not quite sure why that happens, but it's very common, and regardless of what the cause of the cirrhosis is, whether it's alcohol or it's a hemochromatosis, which is where you have a lot of iron in the liver. Iron is damaging to the liver as well and can lead to cirrhosis.
Right.
Or with this viral hepatitis. All of these tend to have a higher incidence of liver cancer. And I'm not quite sure why that happens, but it is a fact.
Okay. Now, I know that, well, put it this way. Is there a possibility of somebody getting cirrhosis and the cirrhosis turning around and going away?
I've actually had one patient who I met at the VA hospital who looked like he was 10 months pregnant. And he was, out to here. He was jaundiced. He was in a bed. He couldn't move. His feet were swollen. And his wife actually divorced him, but married him again because she thought he was going to die. And he lived. And actually, he lived. And the jaundice went away. He did the right thing. He stopped drinking. His ascites went away. His belly was flat again. And he had normal functions. I mean, he had some probably minor scarring in the liver. I had two patients that way. And they lived for years without any problems because they kind of did the right things and the liver was able to regenerate itself. But once you get to a certain point, you can't go back. But if you stop, just before, that cancer thing, you can, get your liver to get better.
Now that was associated with alcoholic hepatitis.
Yes,
though.
both of those were alcoholic. Yes.
Alrighty, all right.
With viral, it may be a little different.
It may be different.
Yes.
So the hepatitis A and B and C
Right.
and D, it may be a little different once the scarring sets in.
Right. But hepatitis A is the only one that doesn't cause scarring.
Oh, it doesn't cause scarring.
No, it doesn't. It's an acute thing that happens and it's gone, and it doesn't come back. But B and C definitely can cause you to go on to cirrhosis.
All right. You mentioned this word twice now, ascites.
Yes.
All righty. Why do you get fluid in the tummy area and your stomach gets so big? Why does that happen?
Okay, because as I mentioned, the proteins that's made by the liver, particularly albumin, holds the fluid into the blood vessels. If you don't have enough albumin, the fluid just kind of goes everywhere. And since the liver is not working, the blood vessels, there are a lot of vessels in the abdominal cavity, they start to leak.
Okay.
And it all leaks into the belly because it's a big cavity and it just fills up with fluid.
Okay.
And that's what ascites is. It's just leakage of protein of the plasma into the abdominal cavity because there's not enough protein to hold it into the blood vessel where it's supposed to be.
Right. Do you ever have to take a biopsy of the liver to try to figure out what's going on?
Absolutely, absolutely. And years ago, we used to do liver biopsies and we couldn't treat anything. We just did the liver biopsies and said, okay, well, you have problems with your liver. But, sometimes we're not sure what the cause of the inflammation is. So we do it to see if it's from iron storage disease or if it's from alcohol or if it's from a drug. And now I'm doing a lot of liver biopsies on diabetics because diabetics can get the same liver disease that alcoholics get. It's called non-alcoholic steatohepatitis. And if their blood sugars are really out of control, if they're gaining a lot of weight, their liver can actually not function and they can develop serious liver disease down the line.
Oh, goodness gracious. Well, let me tell you, we've used up all of our time. And this was such an important and interesting topic. Dr. Sampson, you're going to have to come back and do another topic in your specialty, because it's a wealth of knowledge up there, and we want to get some of it. All right, you got to share it. You got to share it.
I would love to do that.
Thank you very much for coming to be with us today and covering this topic. Thank you very much.
Thank you.
All righty. Okay. Well, it's that time again. It's time for Let's Talk segment. And today I'd like to talk about trouble sleeping. A lot of us have a little trouble sleeping, trouble falling asleep, trouble waking up sometimes, can't get up in the morning. But we're going to talk about falling asleep, because sleep is necessary for life. We all know that. Get angry, get evil, get all, boy. It's like your feet hurting. When your feet hurting, you're angry. When you don't have enough sleep, you can get angry as well. But as far as wellness is concerned, it's very important to get enough sleep. As far as adults are concerned, you need at least 7 to 8 hours of sleep. As far as teenagers need about 9 hours of sleep. Preschool children, 10 to 12 hours of sleep. And newborn and infants need 16 to 18 hours of sleep. Now, types of disorders of sleep. You can have sleep apnea, meaning that there are episodes at night that you cut off your airway and you can't breathe and you're waking up and it continues to wake you up because of that problem. It's called obstructive sleep apnea. There's insomnia, which you just can't fall asleep for some reason or another. And there is restless leg syndrome, where you feel tingling or pain in your legs and it just won't allow you to go to sleep. Well, to improve your sleep, try to maintain the same schedule as far as sleeping is concerned and create a regular routine. Listen, we've come to the end of our show. So, listen, in closing, remember caring and sharing. Email me, www.medmoments.com, and tweet me @medmoments. Never institute any change in your medical therapy until you consult your physician. I trust that each and every one of you have continued good health. I'm Dr. Omar Bey, and this is A Moment in Medicine. Until next time, peace to you all. All righty. Thank you, Dr. Sampson. Thank you very much for coming in.